My name is Elisabeth Mack, and I'm the founder and CEO of Holistic Caring.
The Curious About Cannabis podcast is produced by Natural Learning Enterprises, a mission-driven company dedicated to enhancing critical thinking skills and public scientific literacy about life in the natural world. If you like Curious About Cannabis, consider checking out some of these other learning initiatives by Natural Learning Enterprises.
Come on, Molly! It'll be an adventure! Phoebe called out as she followed Brother Toadstool. Brother Toadstool led Phoebe and Molly into a tunnel that went deep down into the ground. As they climbed into the tunnel, they found themselves getting smaller and smaller and smaller.
Our new children's book, A Toadstool's Treasures, takes young readers on an adventure into the fun and fascinating world of fungi. Learn more and find mycology-related learning resources, games, and lesson plans for teachers and homeschooling families at toadstoolstreasures.com. Biodiversity loss due to habitat loss and fragmentation is rapidly increasing around the world with devastating consequences. Learn how you can help contribute to native habitat corridors in your community and reconnect with your wild neighbors at gardenwild.org. Oregon recently became the first state in the United States to legalize the medical use of psilocybin. As cities all over the country begin to decriminalize the use of entheogenic plants and fungi, it's time to have a serious discussion about psychedelics. The Serious About Psychedelics limited series podcast is coming soon. Learn more at seriousaboutpsychedelics.com. You can learn more about Natural Learning Enterprises at naturaledu.com. And now, back to the show.
Hey everybody, this is Jason Wilson with the Curious About Cannabis podcast. Thanks so much for tuning in once again. So today I'm really excited to be joined with Elisabeth Mack, who's a registered nurse and is the founder of a company called Holistic Caring, which is focused on essentially training people to teach other people about the therapeutic uses of cannabis. And I'm particularly excited because Elisabeth and I have joined a new venture together. We're working on building new educational materials and doing teaching together. So very, very excited to be joined with Elisabeth Mack. Elisabeth, thanks so much for coming on the podcast.
I'm honored to be here. Thank you for the invitation, Jason.
Absolutely, yeah. And to kick things off in a good way, for those that might be listening that are totally unfamiliar with you and your work, let's dive a little bit into your background, and then we'll talk about how Holistic Caring came about and kind of some of the stuff we're working on now. But how did you, I guess to start, you're a nurse. What types of healthcare environments and patient populations were you working with before you kind of dove into the world of cannabis and cannabinoid therapeutics?
Mm-hmm. Well, okay. So 1987, I graduated from college with a Bachelor of Science in Nursing, Bachelor of Arts in Psychology. And I spent my first 10 years in hospital working in mainly psychiatry because that's why I double majored in psych. I just knew that I wanted to help people in that population. So that was really my first, after about 6 months of med surg, and my first post was the VA, Hines VA Hospital in Chicago. And so I did 6 months of med surg, which is almost mandatory. And then I got into psychiatry, which is what I was waiting for. And shortly thereafter, I was charge nurse of the evening shift of one of the psych units. There was 240 psych beds in this hospital.
Wow.
So 8 units of 30, right? And I got to run one of those. And so it was quite amazing. I loved my journey. And so my first almost 4 years were in Chicago there. And then this was 1990, the beginning of 1990. I took a post with a traveling nurse company and did some travel nursing. And that's how I came out to California. So then I was up in Northern California at Sequoia Hospital, worked another couple of years there. And then I came down to Southern California to Escondido, which is where I ended up moving and buying a house. And that's when I got into grad school, because I knew that I couldn't just be a nurse, right? I wanted to do more, and I knew that I was bigger than direct patient care. I wanted to run the hospital. I always had these ambitions and bigger visions. So that's when I got into the MBA in healthcare administration. So from 1994 to 1996, I finished my MBA. And from that point on, I spent the next 20 years within insurance companies. So I did the first 5 years in operations, started out in clinical operations, then general operations for Medi-Cal managed care populations. And then I ended up going into the consumer division when we started Healthy Families, which is the CHIP program, the Children's Health Insurance Program. I was quarterbacking that for HealthNet, and then crossed over into getting licensed in insurance, which is, I did that at the end of 2000. And then so I've maintained an insurance license ever since. So I maintained my license in nursing as a registered nurse for 30 plus years, never let that lapse. And then I'm licensed in all lines of insurance. So life, health, property, casualty, all of the commercial lines, as well as annuities and all of that. But the mainstay of what I worked in the most was employee benefits. So I spent like a solid 15 years writing employee benefits. So when I first joined the American Cannabis Nurses Association, I'm like, I'm not a nurse. Because I don't see myself as a nurse. I see myself as an insurance executive. And so my last real job was the regional sales manager for Anthem Blue Cross for the county of San Diego. So my post was overseeing the broker development sales channels for about 1,000 different brokers here in San Diego County, and I would help them with benefits and that sort of thing. But so I know healthcare inside and out. And
really.
From several different stages, right? So as a nurse, as a payer, and a person on the insurance side, and then as a patient. So in 1993, I was injured by a patient in psychiatry. We were doing a takedown, and I tore something in my shoulder, and it got worse. And so I went to orthopedics, and they gave me the cortisone shot and physical therapy, and that didn't really work. And what happened was I started to feel like I couldn't brush my hair, I couldn't brush my teeth, I couldn't use my right arm. So they're like, you have impingement syndrome. Let's just, go in there, clean it up. They ended up taking an inch of my clavicle out to give it more room. Well, what could go wrong? It grows back internally rotated. It grows back wrong. The neck bones all come out. And so everything started hurting more from that surgery. And what did they tell me? You have fibromyalgia. Take Vicodin. Take muscle relaxants. Take all these pills. So I took the Vicodin for about 6 months, and I'm like, I can't do this. I'm a new MBA, and I'm working at a desk now instead of working in a hospital where there's constant motion. I'm sitting there, and I was falling asleep, and I'm like, I can't take these Vicodin. So I switched over to high levels of Motrin, and I stayed there for 20 plus years. And so all of those years, and everything snowballed. I wasn't all that well. So at the end of 2014. I happened to have crashed my bicycle. I went out on leave to have surgery. Again, this shoulder. This is my second surgery. I've subsequently had a third surgery where I got new ligaments in there, because this has been my nemesis, this right shoulder. And so it was crazy because I knew I didn't want to stay at Anthem. And I was implementing Obamacare. And, as an insurance company, what did we do? We jacked up the rates, we took away benefits, we increased deductibles, we screwed up the networks. Even the providers didn't know where they belonged. And it was quite chaos. So and the other thing is I'd go up to corporate and everybody's happy about share prices. And, Anthem Blue Cross is making more money than ever with Obamacare, and we're screwing everybody. And I had a moral objection to my work. And I said, I need to do something else. And I went to my chiropractor right after that surgery, a couple weeks. And the chiropractor is like, why don't you have Denise work out your shoulder? She was doing a medical massage, and she was using CBD in the oil. And I'm like, what is this? It smells funny. And she goes, it's cannabis. And I said, I don't want cannabis. And that was my foray into this, because that's what she said. You have an endocannabinoid system, and this is going to help the inflammation. It's going to help heal. It's going to help the pain, and you can get back to using your shoulder faster. And I said, okay, sign me up and tell me more. And that was January of 2015. So going on 6 years. And what happened then was she started telling me about CBD. She told me about Cannamon, which was a flash-dried CBD, and everything was Humboldt flower. And so I had flower-derived, lab-tested, organic, whole plant cannabis, CBD. And I started to take that, and the inflammation in my body started to go away. I started to go from 2,000 milligrams of Motrin a day down to, well, today, 200. I'll take like one Motrin instead of 10.
An order of magnitude.
Yeah, right. And as far as the Flexeril and the muscle relaxants, I was taking 8 of those a day, and I was still in pain all the time. And now I take 1 every other day. So it's insane. And I used to have constant migraines, and I was taking Furanyl every day, and then Imitrex when that didn't work. I also at that time had high blood pressure, and I don't know why, but I just got it. And so you're going from 150 to 90. And so they put me on hydrochlorothiazide with cannabis. And the last several years, I'm 120/70 all the time. Haven't had a high blood pressure pill in forever. I used to take Effexor for depression. Don't have that anymore. I used to take Klonopin for sleep. Don't have that anymore. I used to take Advair and albuterol. I had lifelong asthma, and I don't take any of those anymore.
Wow.
So, Jason, like what I found over the period of the past several years in the ability to wean off pharmaceuticals and find better health. And of course, I started studying functional medicine in dovestep with this, the cannabinoids, because it's not just about cannabis. It's how do you use cannabinoids to be a facilitator to greater health? And you have to look at functional medicine for that. So I changed my diet. I went to, from processed foods to whole plants. I have a lot of, like, I just had yogurt and berries. I'll have a salad for lunch. For dinner, I'll have lean protein and vegetables and a small amount of starch. And I went from a few glasses of wine a day to 1 to 2, and just completely changed my diet into and the inflammatory markers. And now I exercise more. I'll take a vape. So because otherwise, was I moving? Was I doing my floor yoga? Was I
Right.
been able to strengthen and tone and stretch? No, because I was always in pain. And so now that I'm out of pain, I'll take a vape, a puff or two of like a 1-to-1 before I work out. And every night I can do floor yoga, and I've completely changed my body. I lost 20 pounds. I feel great. And so cannabis and functional medicine changed my life. And when I figured out how to do this for myself, I knew I needed to help others.
Yes. Yeah. And I mean, there's so much that you just said that I want to spiral off of. I mean, one, it's fun to see as you're talking about that transition. Folks listening can't see, but I can see you light up as you're like remembering, this process and where you've come now. And one thing I knew we were going to get along really well. I didn't realize you had your background in psychiatry, but when I was in undergrad, I was preparing for psychiatry, almost double majored in psychology. I was like class away from getting all the credits. And I was like, no, I'm done. I'm ready to move on. But psychology and psychiatry is a big part of stuff that I've studied, that I'm very interested in. My wife is a mental health therapist. So one, that's fascinating, because one thing that I think about a lot with my own personal journey, sort of similar to yours, mine is kind of with spinal issues, but there's a mental health component to physical health that I think gets a lot of times sort of glazed over. You're talking about, I'm glad you mentioned this idea that cannabis can be an effective sort of stepping stone towards other modalities, like changing diet and changing your movement and all of that sort of thing. Because folks listening have heard me say it before, but going through all of those drug treatments to try to find relief, especially with a chronic pain issue or limited mobility issue like that, which I can relate to a lot, it's kind of a traumatic experience going through taking these drugs and feeling the sort of hopelessness that sometimes comes with that.
Yeah, and I was going to say that word hopelessness, and so it, as I started to heal myself, basically 2015 was a bridge year. I still worked a little bit of insurance, but I didn't go back to Anthem. I was doing some private work, and then I because I was exposed to this industry, I found out. I was just Googling cannabis and meetups, and there was a bunch of meetups that, and so they started Women Grow down here in San Diego. And so I went to a few meetings of that at the end of 2015. And then January of 2016, I went to the national conference in Denver for Women Grow. And I'm like, people are making medicines, people are selling medicines, but nobody's sitting down and interpreting this for patients. And so that's why in May of 2016, I hung out my own shingle and I started doing this with patients. And the hopelessness that I felt within myself, you just see it in all of these people. And so, going from a nurse to a payer to a patient to now a provider, a one-on-one provider, I really got to see intimately into people's lives. And, they always would trust me and sit down and have a conversation with me. And the beauty of what I do, just like other cannabis nurses, is that you study both sides of the ledger. Somebody gives me their pharmacy list and I know exactly what's wrong with them. And then you say, okay, here are the pharmaceuticals that we might be able to wean and replace with the cannabinoids, and here's how they work, and let's put together a treatment plan. And you see the hope come back in their eyes. You see the joy in their heart. You see the security that they feel and the optimism that returns. And so when we talk about chronic pain and mental health, they're intimately intricate. It's completely interlaced. And people don't even understand the mind-body connection because they're so disconnected from their body. They don't understand how their thoughts are now causing physicality, and discomfort. So if you can, and with cannabinoids, and I always like to explain, with pain, there's three types of pain. Nociceptive pain, where you hurt yourself and there's signaling going from the injury to the brain. Cannabis and THC specifically will turn down the volume on that. You have inflammatory pain and neuropathic pain. So now we have CBD, THCA, some of the anti-inflammatory markers that we could use to use that daytime dosing to be able to turn down the pain signaling and the inflammatory process of whatever's going on in that joint or in the circulation. And then you have central pain. And central pain has a high emotional component to it. And the cannabinoids activating serotonin channels, activating dopamine, it will start to ease some of that suffering and some of the angst and the anxiety and the depression. And all of a sudden, people feel better because they don't even know why they're in pain. But I do my follow-up calls every 2 weeks, and you see the progression where people are getting their lives back, and they're saying, I was able to have my opiates in the last couple of weeks. I was able to start walking. I was able to sleep better. It's an amazing thing. And sometimes you're directly treating sleep, and sometimes sleep is just a byproduct of everything else that's going on. But when you start to ease some of the other pain and suffering, and you activate serotonin during the day with the CBD, at night they're just sleeping better. And so sometimes trying to get people to be patient is a little bit hard because they want it like that. And they're so used to that cause effect of pharmaceuticals that you're like, this is a journey and I'm on it with you. And we're going to find you a way to health and wholeness. And it's a process.
Absolutely. And something that when I teach about, particularly about CBD, just because of the clinical data that's there, I tell people, you look at some of the research with like Epidiolex and you see that, it can take up to 10 weeks for a clinical response to plateau. And so it's even just with the cannabinoid component, not to mention all the other aspects of trying to increase, exercise and improve mental health and all these other things. But just thinking pharmacologically about the cannabinoids, sometimes you really need to be patient for a couple months or so before you can really judge what it's doing or how effective it's going to be. And I think a lot of people have a misunderstanding about that, particularly because of the way that, as you know, that cannabis products are marketed, just like anything else in the world and how things are marketed. It is, it's like, oh, just take this after your jog or whatever, and you'll be feeling great. And, it gives this impression that it's all instantaneous. And one thing I try to bring up anytime there's an opportunity to in these interviews is like, we don't expect that from a lot of other medications, and I think titration is another thing that people take for granted. They think they just take a dropper full and move on. So has that been your experience as well, that there's sort of oftentimes this gap of understanding of how long it can take for that therapeutic response to really make itself evident, and that there's this titration period of trying to find that optimal dose, that minimum effective dose that's sort of like a holy grail of medicine, trying to find that sweet spot. What's your experience with the feedback that a lot of patients have with that?
Mm-hmm. Well, I first off have to tell them this is biology. This is
yeah.
This is not just we're going to take a pharmaceutical activator receptor and cause a response. This is, yes, we're doing the same thing with the cannabinoids, the phytocannabinoids, but it's much slower and it's a much more nuanced, subtle effect. And so that's why my tracking log is so important. I give them a cannabis tracking log, 1 to 10. Where are we at on these variables? I call them gauges: pain, anxiety, memory, focus, mood, energy levels, sleep, blood pressure, blood sugar. All of these things are impacted. And then we write down what they're taking and the dosage. And then we see slowly the trajectory of cause and effect. But you got to get them to understand that this is a process and that it's not immediate. And then they have to sign up for this. They have to believe that they can get well, and that and also it's about those varying degrees, right? So in that tracking log, it's 1 to 10. So we might be starting out at a 7, 8. And then my goal is to get them to a 4, 5, and then eventually to a 2, 3. And then we talk about the quality of life changes, right? So it's all about variability and that sort of thing. And that it's a slow term process.
Yeah. And it sort of highlights a, it sort of highlights a, deficiency in some of the, clinical research as well. One thing that I found in reading tons and tons of studies for the work that I do is sometimes the measurements that are taken during some of these the few clinical studies that have been published, they try to measure things like quality of life and pain scores and all that, but it's often a very short window of time that's being measured, and there aren't many measurements. At least in some of the publications that I've looked at. I'm sure there are some studies out there that have gotten more sophisticated with that, but it's something that's lingered in my head because some of these studies will conclude that, it didn't impact their quality of life, or it didn't impact their pain, sleep, or whatever. And it's like, well, that's hard to judge when you're looking at a very narrow time window and you're only taking a measurement 2 or 3 times. Right. And so I often caution people about how they interpret those results because, once again, going back to, this is a multiple month-long endeavor or years sometimes, and it involves so many other aspects than just the cannabinoids and just taking them and seeing what the response is. And I think that also highlights an interesting sort of psychological thing that a lot of us have about healthcare in general. We're not really taught to think of managing our health as how do we create the space to take other lifestyle actions to get well. It's just still very much the sort of Band-Aid approach, Band-Aid the symptoms. And so it's fascinating that way. And it's something I really want to highlight, this concept of, using cannabis to create the space to then take other actions to reach wellness, and that it's not always this direct response.
Right. And where did we get this direct response? Through all of the pharmaceuticals, from clinical trials and testing. And, you get in phase 3 and it's like in X amount of days, we're going to have these results. And this patient population we're going to have this much efficacy, but it's all BS. You think about, we have a $3.5 trillion Band-Aid in this country. We spend that much on healthcare in America between, the copays and the coinsurance, the entire bloated system, $3.5 trillion. That's 18% of our GDP. Yet, 1 out of 2 of us have a chronic condition that we're living with that impacts quality of life, impacts productivity. And what is the true efficacy of those pharmaceuticals and those treatments? When I think about my last 5 years of direct patient care, they're not getting any better, especially, and there's no pharmaceuticals for any of the neurodegenerative conditions.
Mm-hmm.
There's very expensive ones for autoimmune conditions. And a lot of times they're not effective, and they're also very harmful. Then, and then think about cancer, and it's a shotgun approach. Okay, can we do surgery? Yes or no? Let's do chemotherapy to shrink the tumors. Let's give you 5 rounds of radiation every week for 9 weeks. It's crazy when you think about how they're all experimenting, but it's a sanctioned system. It's a paid for system, which is the other problem with cannabis. A, it's slower. B, it requires personal accountability and responsibility to make those changes, and to start tuning in and reading your body, and seeing yourself as having gauges and personalizing the medicine, using the CBD, the THCA, the CBG, the CBDA, and then the THC and the 1-to-1s and the 4-to-1s, and all of these different ratios. And you have to teach them this is personalized medicine, and you're in the driver's seat, and that this might be several months. But the good thing is, almost invariably, I have people contact me that says, I'm so glad I was patient, because after 6 months, I really did notice a difference. And now I'm able to do XYZ. I can go hiking. I can go, and I have endurance and stamina that I didn't used to have. And they would have never said that with the pharmaceuticals.
Yes. And the sleep thing is so important that you pointed out that if you can restore sleep, just like movement and diet, that has such profound impacts on your both physical and mental health. And it's another one of these things that often gets sort of pushed to the side. I mean, my wife, both of us have insomnia. My wife has it really severely. And, looking at the treatments for insomnia, it's like, we're basically going to try to drug you to sleep. Your REM cycles and everything are going to be totally screwed up, but you'll technically be asleep in that you will close your eyes and you'll wake up some amount of time later. But the quality of that rest is usually not there. And that's even if the drugs work at all.
Right.
And that creates another spiral that's just this feedback loop. You're continuing to get poor sleep. Well, then your body is going to continue to suffer. Your mental health is going to continue to suffer. And then you can see, like you mentioned, that mind-body connection. I mean, even though we don't understand that connection very well, it seems very clear. And there is some very interesting like fMRI and clinical research and stuff on this, that how you think, how your mental health, is operating is affecting your physical health. And it's not just a perceptual thing. Certainly, if you're depressed, pain feels worse and different things like that. But there's also there's a direct connection between mental health and the immune system response and all these other things. And it's baffling to me that we can sit here and talk about this, that the research is there. You can read on these things. It's not controversial, these concepts. And yet you don't see an application of this understanding in conventional healthcare. And I understand the dynamics, it's like a doctor only has a few minutes to see a patient, and the systems that sort of, create all of that. But it is truly, truly baffling, just how pervasive the negligence is, I guess, to acknowledge those pieces. I don't know. It's just, it's super, super strange.
Well, it's what's funded. It's truly about what's funded. And that just goes directly to the pharmaceutical industrial complex. When you think about people taking accountability and using alternative treatments, who are they? They're the wealthy. They're the people that have the concierge doctors. They're the ones that have used integrative medicine and chiropractor and acupuncture and naturopath and supplements rather than pharmaceuticals. They're the people that are, pursuing these mind-body, people that are meditating, people that are praying, people that are eating organic foods, all of this. And it just falls into the wealthy. But one of the beautiful things about this plant is that people can grow their own. they can start to modulate their own endocannabinoid system. They can find their own way to healing. And I've seen this, organically just, stem up in all kinds of people that have found this path that say, I'm reclaiming my health. I'm taking away the dollars that I used to give to the pharmaceuticals. And I'm going to do things better. And, that lies in, part of what I personally want to do is get back to insurance companies with some evidence-based data and say, look, we can really change the trajectory of healthcare in America if you guys pay attention. And prayers that the MORE Act passes, that we're going to deschedule cannabis because it's an impediment to stay on Schedule 1, right? We can't have this be a Schedule 1 drug and say it can help you because people are so stigmatized against this plant, thinking that they're going to go crazy, thinking that it's reefer madness, thinking that they're going to go to jail and prison and lose their life and their livelihoods. And so there's a lot of education needs to take place.
Absolutely. And I mean, we're now at a place, seeing the cannabis law reforms that happened in this recent election was mind-boggling. I'm originally from Mississippi, so to see my home state not only legalize medical marijuana, but legalize it in a way, I don't know if you've looked at the program that they passed. So there was an interesting thing happening in Mississippi. So they put together this model that to a large extent kind of mimicked Oregon's medical marijuana program before legalization came through. And when Mississippi's government saw that, they were like, oh no. And they put together their own alternative medical marijuana initiative that had no definitions. It was essentially an empty plan that if it passed, nothing was going to happen. It would just enter a sequence of bureaucracy that would never end. And I was amazed to see that in my little home state where I'm accustomed to, when I grew up, the prohibition was so strong, had friends go to jail over cannabis, all these things. And now to see a bipartisan support for what really is a very liberal medical marijuana program, it just really opened your eyes, the fact that, okay, on a federal level, like we're at a point now where the absurdity is just through the roof. 1 in 3 Americans in the country lives in a place where you can get cannabis legally. Obviously something needs to change. And hearing your background in insurance, I wanted to get to this point. What are the impediments to insurance companies covering cannabis therapies in states where it's legal? Is it just a federal thing? What needs to happen to open that up? Because I know a lot of people, a lot of medical patients or people that are in adult use markets that are using cannabis, medically, which is tons of people, myself included. One of the issues that gets raised is the expense, just how expensive it is. And even though they could grow their own, some of them maybe don't have the resources to or whatever. So there is a cost issue. So what are your thoughts on that and how insurance and cannabis, what are the hurdles and how do we move forward on that?
When I give my Cannabis 101 presentations, especially to senior centers and that sort of thing, I do tell people you got to financially qualify for this. If you can spend about $150 a month, we can get started. And when you do the cost benefit analysis, that's not a bad idea. But I just did an article about veterans and people that are veterans, PTSD, chronic pain, anxiety, insomnia, depression, all of these things. A lot of them will get a bucket of meds sent to their house, mail order, for less than $100 a month copay. And then they go into the medical cannabis programs, and the study was out of Massachusetts. They're spending on an average of $300 a month. And so that variance is unsurmountable for a lot of people that don't have the funds. So, but the barriers to insurance coverage are several. One, it needs to be descheduled, come off of Schedule 1, because obviously it can't be illegal. 2, the FDA needs to get involved, and then there's 2 tracks. So and I wrote an article about, is this a botanical supplement or is this a pharmaceutical? And it is indeed both, right? So we have this as a botanical supplement. And if it goes that track, what do we need? We need good manufacturing processes. We need generally recognized as safe ingredients. We need organic certifications. We need standardized, reliable, consistent, because that's the other thing with cannabinoids. It's like, okay, if this works, how do I ensure that I can always obtain this? If I put a renewal for my Advair or my Effexor, it's going to show up and be the same thing every month. With cannabinoids, it might not be that way because this is a plant. And even if you take clone cuttings and grow them in separate greenhouses, you're going to have different effects of the cannabinoids and the terpenes and the combinations based on the sunlight and the air and that sort of thing. So standardizing. And yet, do we want it to be the pharmaceuticalized version? Do we want it to be Epidiolex? Do we want it to be $100 a month versus $3,000 a month, which is the cost for Epidiolex? And when we talk about THC, then that's a whole nother ball game, right? So I work with a lot of like a 4-to-1 oil or a 1-to-1 oil, very effective, especially for seniors. Neuroinflammation, physical inflammation, sleep, anxiety, those ratios. And I do a lot of 60 plus type of populations, and looking at how to, and they all have diabetes, hypertension, inflammation, pain, insomnia, anxiety. You get to be seniors, over 80. And how many of the percentage of that population is on Seroquel, risperidone? They start taking antipsychotics because they're exhibiting dementia. And people with Alzheimer's, they're on all of these pharmaceuticals, and then they're on morphine, and it's ridiculous. And when you can start to say, look, we're going to use different ratios, different times of day, and different effects, and different cannabinoids and the acidics, then you're going to put together this treatment plan that's going to be much more effective, and then, okay, so insurance companies, what are they going to need? Cost benefit analysis. They're going to need evidence-based pathways. And so what I need to do now, and when I see patients, I write a SOAP note, and that goes in my acuity scheduling. I need a really robust EHR where you can start to see that cause and effect, where patients can start logging every day and tracking the data and proving the reductions in blood pressure and blood sugar, the reductions in depression, the improvements in sleep, the improvements in functionality, pain control, quality of life, productivity, all those things. So when we start to plug in that, then we can go back and say, look, here are the variables that we've been able to tweak so that we have lower costs, better outcomes, and better productivity, happier people, and so that's the dream. And, with my positions, I'm on 2 boards. One is the American Cannabis Nurses Association. And so with that, I went to a nursing leadership conference this summer, and it through exposure to somebody in one of the breakout rooms, it was all in Zoom, of course, because we're in COVID. Yeah. There was this PhD from the VA who had so many initials after her name, and she was impressed with my story and what I'm doing, and she goes, "Would you speak to us for the nursing organization for the Veterans Affairs?" And so that was what I recorded. That NOVA presentation is on my website for anybody that wants to see it, and I put in there what the basics of the endocannabinoid system is, how cannabinoids work, some of the pharmaceuticals they might be able to replace, incidence of PTSD. And even if you just go to that and you're like, CB1 receptors are just profuse through the amygdala, the hippocampus, all of these things where PTSD centers are, the nightmares, the intrusive thoughts, the flashbacks, the anxiety, the all of these types of conditions that can be modulated with CB1 activation of THC, CBD, bringing up serotonin. And now we can bring people to health. And you see these veterans that are responding very well to cannabis. And so, I hope that was a clarion call for them to look at this and say, we need to look at that. And I finished the presentation with the nursing organizations that are active in this, and some of the, just even the fact that we have 1,500 nurses in the American Cannabis Nurses Association, and Cannabis Nurses Network has about 500. Then my other board is I'm the director of health for Los Angeles NORML, and so the National Organization for the Reform of Marijuana Laws. And so I serve on that board. And then there's a lot of national presence, which is amazing because they tell me everything about, the different qualifying conditions and the state programs and increasing access and affordability. NORML is really fighting to just legalize and normalize recreational use and that sort of thing. And I keep fighting for, there needs to be 2 paths. Yes, recreation needs to happen because it's a benign, safe substance that people can use. And B, we have to build that medical door where we can educate clinicians about this, and say, here are the starting pathways. Here's everything you need to know. And so, between these two things, I'm trying to get out there and educate as many people as possible to really move the needle on this.
Yeah, absolutely. You just touched on something that has been very frustrating to me in Oregon. So when legalization happened, they essentially normalized the rules for both medical and adult use to be largely the same as far as the quality of products. And I was like, oh my gosh, that's such a crazy lost opportunity to do something special, because in my mind, what I would like to see, and especially given my background working in testing labs and stuff like that, and sort of coming at this from a public safety perspective, adult use cannabis. Does adult use cannabis that's being used personally for whatever reasons you want to, you're over 21, and just having the access, given the safety profile of cannabis, and even when talking about contaminants and that sort of thing, we can go down rabbit holes around all the contaminants you can find in cannabis. But at the end of the day, even with that piece accounted for, cannabis is extremely safe. And I'm not sure that we need such strict testing rules on adult use cannabis. I mean, we don't have them on so many other things that we consume regularly that have all sorts of chemicals and things added to them that we don't question. But on the medical side, I would like to see strict testing rules, and that if someone buys quote unquote medical cannabis, that they know that it has been held to this higher standard, and that, things have really, there's been a lot of work done to ensure that, the chemistry and that it's contaminant free and all these sort of things. And then the medical side has more meaning and more weight.
Right.
But it seems like a lot of these states are, I don't know. I think it stems from this mentality. When a lot of cannabis laws were starting to change, there was a lot of argument from opposing sides that all medical is a stepping stone towards adult use. And I think that mentality has maintained. I think that a lot of people see that, like, once legalization happens, you don't need medical anymore. And I'm really disappointed to see that trend, and I'm glad you pointed that out.
Well, I agree. And this is, and one of the, I feel like I'm beating my head against the wall down here in San Diego because, and remember, I got into this in 2015. So the thing is, I've been knocking on the doors at dispensaries saying, allow me to build you the medical door, allow me to build patient teaching, allow me to do consults, allow me to start shaping your formulary, which is, for me, I call everything a formulary. That's a drug list, it's the menu, because, I want to have all these different categories. And so, in what I've created on my own, is my course, and I have a formulary in the toolkit where I've literally broken down with all the indications, the dosage, the pharmacodynamics and pharmacokinetics of these different medications, and then the titration schedule and who the population is that would be using this. So literally from every medicine that's in a California dispensary, I have dosing guidelines. And I call that my formulary. And so I'm trying to tell the dispensaries, help me build a true medical door for you, and we'll make a fortune together. And it's nothing but a closed door because of recreation. They're just not interested. And, the industry is so immature still because there's a lot of cowboys. There's not a lot of people that are making money on the medical side. There's nobody that are making money. Everybody's just kind of starving, and it's a pay to play. You have to just, I've been living on savings for the last 5 years, but at some point that has to change. But what I decided to do was just sidestep to the dispensaries. Well, I had my own collective for years and years. So with Prop 64, that, got rid of Prop 215, where we got to be able to have a collective. So when I first started doing this, 2016, I opened, so Holistic Caring was my nursing case management and one-on-one consultations. And then I had Balance RX, which was my collective. And that consisted of a lunchbox, the cooler that I would take out and go see patients. And I'd have a range of tinctures, I'd have a couple of microdosed edibles, generally 1-to-1 chocolate. I'd have topicals. I'd have some patches, and I'd have a 1-to-1 vape. So I'd have this, little pocket dispensary that I could take out and see patients, and that's what I used. And then Prop 64, I had to close that, right, and then send them back to the dispensaries, and I couldn't control the quality. I couldn't control, that sort of thing, and and it's a very imperfect system. But at the end of the day, what I ended up doing was just really doubling down on holistic caring. And I said, what I need to personally do is start really writing curriculum. And during the run up to Prop 64, there was a lot of medical cannabis is good for all of these things, and a lot of media coverage on it because everybody wanted to get these things passed, right? And so San Diego, there's so much buzz, and the Americans for Safe Access meetings and Women Grow, and everything was just booming. That's when I had to hire nurses. And so I needed to get some other nurses because I had a palliative care physician who was giving me referrals. And in a perfect scenario, those people benefit the most. So I needed to add a few more nurses to see all these patients. And so I wrote a training manual for the nurses. And that training manual became my book, Cannabis for Health, Become a Coach. And that book became a course. And so now at holisticcaring.com, you could look at my courses and see, what's in the, so module 1 is all of the history. So the history of cannabis as medicine, the history of prohibition, and then the history of the research and Meshulam and all of the early studies into how CBD and THC works, and that path of 20 years to find the receptors, and then a few more to find the endocannabinoids, and to lay it all out. And then I break down cannabinoids. And so endocannabinoids, phytocannabinoids, synthetic cannabinoids, all the pharmacology, how this works, pharmacodynamics, pharmacokinetics, what are the processes of the body utilizing these medicines. Then module 2 is all about the conditions that can be best served by this. So neurology, so neurological and neurodegenerative. Then I go into cancer. And using it for palliative and then high doses, and how to really maybe treat cancer. We can't say that it treats cancer, but it can induce apoptosis. It can inhibit angiogenesis. It can be anti-proliferative. So, we can definitely give people a fighting chance and the ability to tolerate the traditional chemotherapy and the other modalities of care that they're going to have. Then autoimmune conditions. Imagine the sky's the limit with that, because you've got inflammatory conditions going on in the body, and cannabinoids might be able to clean the slate and reset things and give people back their function on that. Then all of the inflammatory things, cardiovascular, metabolic. So I have a whole section on that. And then mental health, anxiety, depression, psychosis, bipolar, insomnia, PTSD. How do you use cannabinoids for that? And then I cap that off with functional medicine and how to use the phytocannabinoids for all of these different ways to change the diet. And I'll even tell people, microdose THC before you eat. So going from processed foods and things that are salty, fatty, and sugary to whole plant foods. Now, okay, I don't like salads. Well, take your kale, your arugula, your spinach, put some beets in there, put some red peppers, put some lentils, and some good dressing, stir that up, and now have like 2 milligrams of THC before you taste it. Boom. Now all of a sudden we can change your taste buds. How do we use cannabinoids to get you out of pain so that you can move, to get you into a place where you can do that floor yoga every night so that you can take a walk and do some stretching, do some breathing. Now, how do we take a 1-to-1 puff and have like 2 puffs of that, then sit down, quiet the mind, stop those incessant thoughts, go within, connect to yourself, your spirit, and do some meditation and prayer, and then come out of that and try and have better conversations and better relationships with your family and friends and your coworkers. And in conjunction with therapy, how do you start speaking up and setting boundaries? Because holding in negative thoughts and things that you need to be expressing is what keeps us ill. And so you see the way that I work. It's really, all encompassing, but that's what brings people to health.
Yeah, absolutely. There's no way to escape the interdisciplinary nature of all of this. And something you've brought up multiple times that I wanted to make sure to talk about is the cannabinoid ratios. Because one thing you keep bringing up is the 1-to-1s. That's personally my favorite ratio, 1-to-1s and 4-to-1s, when I'm dealing with more serious issues with my back pain and that sort of thing. But let's spin out a little bit and talk about the ratios. How, when you're working with someone and trying to think about what types of products might be best for them, do you have sort of some of these ratios kind of now categorized of what's most often going to be better for certain things over other things? And what should people kind of know about the ratios of these cannabinoids? Because it's getting more complex as more minor cannabinoids are being bred out and isolated and introduced into products and stuff. It's not just CBD THC anymore. We've got CBG and CBN and all these other things, the acidic cannabinoids, which often get woefully ignored. So yeah, let's just spend a little bit of time talking about those ratios. I guess to start it, how did you come to discover that ratios are important? And then we can talk about how you apply them.
Well, yeah, first of all, I was trained. Remember when I had my own collective, I was trained by medicine makers. I was trained by the people that were making these medicines. And Akasha was one of the first brands that I carried. And so Julie, the formulator and owner there, started teaching me about these different cannabinoids and different ratios and the acidics and that sort of thing. And so, but really it all goes back to pivoting around THC. How much THC is needed? How much tolerance is there already? Is this a novice? Is it a complete newbie? Elisabeth, I'm not going to smoke anything and I don't want to be high. Those are the first two things that most clients, especially over 60 or 70, say to you. So, you start low, you go slow. And again, you have to set expectations. And this is a process. My job is to keep you safe. My job is to expose you to all of these routes of administration, maximize the benefits, minimize the harms, and give you your best efficacy and safety every day. So it's a path, right? But, if somebody comes to me and their pain levels are a 7-8, we're not going to start with a 20-to-1 or a 30-to-1. That's not going to do anything. I need THC to bring down those pain levels because you do want, some efficacy out of the gate. So I might start somebody with a 4-to-1 for a few weeks, where it's 4 parts CBD, 1 part THC, but there's enough THC to have an impact. Somebody that is really screaming, you might just start with a 1-to-1 and then control the THC exposure through dosing. So you might take a 4-to-1, 5 to 10 milligrams, where a 1-to-1 you're going to take 2.5 to 5, right? So and so this is and what I always say I love about this medicine is it mixes science and art. It gives you the ability to study everything, know the pharmacodynamics of those different cannabinoids, and then intuitively sort of pray about it and say, what do I need to help this person in front of me right now? And how do we get there? And, when I explain things in this manner to patients, they always believe me somehow, and I don't go wrong for the most part. I haven't hurt anybody, and the Hippocratic Oath is first do no harm. My Wesley Methodist oath is don't do no harm and do all the good you can. And so I blend all of my science and art and intuition and religion and just practicality and stair step people through this process. And a lot of times also I'll talk about daytime and nighttime. So the ratios, you might want that 10-to-1 as a morning dose. Maybe we have some cognitive issues. So CBD, CBG, right? That's a beautiful, like the neuro formula. CBD, CBN at bedtime. You can use those. And that might be a first step that, again, going back to safety and reinforcing that for patients, especially elderly, is a great way to go because CBD, CBN, or a 1-to-1. So is there pain? Is there a phobia of THC? And so as you're getting them more and more acclimated to THC, then you can use that. And you want there to be a certain hitch where that buy-in from the patient is, I get this. I understand what I'm doing. I'll take more accountability, be in that driver's seat of personalized medicine. And they learn to use the ratios. And so a lot of times I'll set them up with a kit. Your 10-to-1 CBD, THC, or a CBD, CBG in the morning, acidics in the afternoon. I do this a lot with cancer patients where we'll use a CBD in the morning, a THC at bedtime, because you don't necessarily want CBD and THC present at the same time because CBD is a partial antagonist. And so THC, you want that to lock on and really help the body heal at night while they're sleeping. And then you give the CBD in the morning, backs that out, gives them a wake up. And then in the afternoon, when we're trying to increase milligrams to get their milligram count, some people want to go up to 5 milligrams per kilogram. I never believe in a gram a day. You don't need 1,000 milligrams of cannabinoids to heal cancer. But if we do want to go to a few hundred milligrams, then you can introduce CBDA, THCA as an afternoon dose, right? And so patient teaching, again, of course, you have to go back to affordability. What are you treating? Yep. That sort of thing. But as long as they know that you care, that you're knowledgeable, that you're not just making this up, you send them some articles to back up the science on what you're saying. Please share this with your doctors. I want the providers to always know what I'm doing. I always tell patients, please send your doctor to my website, have them read some things, have them call me. I will talk to them at no cost, telling them about what you can do here, and not everybody takes me up on that. The doctors aren't necessarily ready to, knock on the door and say, Elisabeth, train me. But, that's where, I have my protocols and my courses because, I talked about the first two modules. That last module in my course is, what are patient considerations and legalities? Mm-hmm. What are provider considerations and legalities? What is the scope of care and standards of practice? What can I really talk about with these patients? What are the guardrails and the guideposts to these conversations? What are the costs? What are the barriers? Some of the things that I've talked about here. How do I, what kind of resources do I need? Even just going to PubMed and putting in cannabinoid and Parkinson's, cannabis and MS, cannabis and cancer. You need to teach them how to do this. And so, I could never stop working because this is my passion. This is my life. This is what I've become. And so, at any point in the chain, whether patient, family member, provider, I'm ready to provide what they need. And then I close out that third chapter with all the regulatory stuff. If somebody wants to get a license, what is license for cultivation, manufacturing, Department of Public Health, extraction, testing, distribution, micro businesses, how do all of this work? And then what are the networking and things like that? So, I have a really robust course that teaches people literally everything you could possibly need to know. And it's essentially a culmination of the last 5 years of my life.
Yeah, absolutely. And it's so funny to hear how your book and course developed because it's so similar to my work as well, even though we work in sort of overlapping but different fields, or you're in the clinical side and I'm more of like the lab science and research and all of that. But very similarly, I've always had this passion for teaching. And so that's something I've always done. And then it's sort of like, oh, well, I need a textbook. I need, I'm trying to share information with people and what I need doesn't exist. So you start writing sort of like casual things to give to people. It evolves. It becomes this whole thing unto itself. And, and then years later, you're like, oh, I have a book and course, all these things that have developed organically out of the need that you have to execute your passion, to teach people. That's so cool. And one of the things that you just mentioned that I want to touch on before we end our conversation here, you touched on the idea that you don't need 1,000 milligrams of THC or cannabinoid to, do something like treat cancer. But that's a widely held belief in the industry. It's something that gets perpetuated in dispensaries and things. So I guess one of the last things I want to ask you about are cannabinoid protocol myths. What are some myths that you see in the industry or that are expressed from patients, that sort of thing, what people think that's needed in order to sort of, for lack of better words, make cannabis work, that actually isn't true. And you just touched on that one, but are there others? And do you have any concerns over how cannabinoid therapeutics is talked about in the industry? Because it's very casual.
Right. Well, cannabinoid therapeutics in the industry is largely driven by bud tenders, and they don't
Yeah.
have any clinical indications and protocols. They're just making this up, and they're trained by the people that come in and do the patient appreciation days, and that's a marketing rep that was hired for sales, and that's just misinterpretation. That's just perpetuated down the line. I had somebody from Tikkun Olam who was their representative telling me that a 1-to-1 is half sativa, half indica.
Oh, geez. Oh, no.
Right? They don't even know that it's
Oh,
CBD to THC, and this is the sort of thing that gets handed down to patients. But I mean, in the dispensaries, they'll say, "Okay, pops, you're over 70. All you need is CBD." And they don't understand that they absolutely have to have THC. For to get out of pain, to get to sleep, or it's again, this goes back to why we need to build the medical door. There
yeah.
needs to be, this is recreation, and you can go and self experiment all you want, but if you want to dial in efficacy and really approach outcomes, really approach layering in how this interacts with pharmaceuticals and the things that you need to. How many people know that you need to space your medications in 90 minutes from your cannabinoids so that you can and always give the drug first, allow that to process through the CYP enzymes.
Yep.
And then, an hour or two later, then you have the cannabinoids, and then CBD is not going to impact that metabolism of the drug. Bud tenders are never going to know this. So there has to be a medical door. But, on the 1,000 milligrams, I believe that was perpetuated by the people that are making the oils. And,
Yes.
Rick Simpson basically started that off, RSO, full spectrum or fully extracted cannabis oil. You take 1,000 milligrams a day for 90 days. Then you're going to be healed, right? And these are myths. These are tales. But if you tune into Dee Mary and some of the scientists that are working on this around the world, they'll give you better protocols. They'll give you that 5 milligram per kilogram. And then the other thing, and so how do you do that? Okay, I'm 135 pounds, divide that by 2.2, you get my kilograms, it's like 64 kilograms. And then you times that by 5, and that's your maximum dose. And then how do you break that up between CBD and THC? Breast cancer, hormone driven, endocrine driven, you're going to want to take more CBD, very little THC. Lung cancer, brain cancer, you want a 1-to-1 or a little more THC. And so, and these are just things that clinicians have been talking about for years in medical conferences. You look over there, you see all my conferences, right? Like I've been to, Patients Out of Time a couple of times. I've been to ACNA conferences. I've been to NCIA. I've been to the Cannabis Science Conference. I've been to Women Grow many times. I've been to all of these different science conferences where people really do talk about this. And there is a medical door. And CanMed, I've been there a couple of times. Yeah. And so that's where the clinicians share and exchange this information and the ideology on what we're doing. But Jason, the beauty about this is that we're just at the doorstep. Clinically, we're just at the doorstep. And the pathways that the reformers have advocated for and led the door with, Americans for Safe Access and NORML and these organizations and NCIA all working collaboratively to diffuse the myths, assuage the fears, build the system. Then eventually the clinicians will really get behind the wheel and start to really work with patients and understand the ability to wean off the pharmaceuticals to give patients better quality of life, quality of health, less side effects. You're not doing short-term or long-term damage to kidneys and livers and stomach and colons and all of this and brain. You think about all the harm that those pharmaceuticals year after year do, and then think about the cannabinoids. And, we don't have outcome data that says, there is no long-term consequences of this, but I can't find any right now. It doesn't appear to be causing any harm when we're talking about biology and modulating that. And then going back to, the numbers and the milligrams and the protocols, that all needs to be cause and effect and monitoring. So when I'm working with a cancer patient, what's going on with your labs? What's going on with your scans? Maybe we need to flip these ratios. Maybe you need more THC for a while. Let's bring in some more of the acidics. But it's where we are working side by side in collaboration with that patient, which goes back to we need to involve the providers. We need the prescribers involved so that they can take care of their side of the treatment plan and we can take care of our side. And eventually we get to a seamless system where it all works together.
Yeah. What you've just highlighted is, I think, something that's so important for people to understand, that our current system has siloed different pieces of the puzzle and is really preventing that collaboration. And absolutely, I mean, clinicians, you mentioned the Hippocratic Oath. Like, this is the job of clinicians. This is what you sign up for when you take on this role in society, is to try to find how to improve quality of life, minimize harms, and help people get control over their health and to feel empowered, rather than a slave to a system that's just sort of shotgun approaching everything all the time. And so there is an optimistic future on the horizon, for sure. And the work that you're doing, and so many others that I've been talking to, that are trying to figure these pieces out and share what they've learned and try to connect people with this truly medical side of the industry, that there are these clinicians out there that are really trying to understand what's driving patient outcomes and trying to compare notes, and doctors and nurses like looking at each other and saying, are you seeing this, are you seeing this, yes, no, so that we can start to build a currently deficient system of understanding that should have been built over the past 100 years but wasn't because of prohibition.
Right.
So one thing I'm excited about with I mentioned at the beginning of our conversation that you and I are founding members of a new organization. It's the Institute of Cannabinoid Medicine, and I'm hoping that through that organization maybe we'll be able to bridge some of these gaps, connect these clinicians together, compare protocols and outcomes, and try to get some unified voices together, and to share information that's been reviewed by all of these clinicians and everything, and take the best wisdom and understanding we can out of the experiences that all these clinicians are having, and folks like myself coming from testing labs and have these sort of other perspectives on it, and to distill that down into something meaningful that we can really drive towards that future, drive towards opening this medical door. And then for the folks that are self-experimenting with personal use, adult use, and everything, that they still have access to that information and that they know how to get there if they need to. So that's all really exciting, and I'm really glad that you and I get to work together in that capacity to develop some courses and content and critically evaluate all of this information and try to do something special and pave that way.
It's not only with the curriculum, but then my part, I think, in all of this for the Institute of Cannabis Medicine, or TIOCM.org, please check it out, is building those consulting bridges, right?
Yes.
Take somebody like me, and I can go in and train people at Scripps Clinic or Sharp Reese Steely Medical Group and say, okay, give me 20 clinicians and 2 hours, and I will take them through a presentation and give them some CE, and give them some, a great way to start this, and getting the clinicians involved, getting them curious, and then think about them in their silos, think about them in the mindset of futility and burnout, and now give them the idea of how the endocannabinoid system can be modulated to enhance health and reinvigorate them back into the practice, into the discipline of medicine, which is really always science and art combined, and get them back into passion, and driving outcomes that really make sense in a much more holistic and empowering way for the patients and the providers.
Absolutely. And to wrap this all up nicely, it goes back to hope and restoring that sense of hope, not just in the patients, but also in the providers, that a lot of them, and I know from talking to them, so many of them feel very depressed and constricted, and are trying to find ways to more effectively do their job, what they signed up for in the beginning. And so that, the grand piece of all of this is, how do we restore hope to the healthcare system, restore empowerment and hope to people everywhere that are trying to just gain control over their lives and maximize this finite amount of time that we have here, in this existence as we know it. And, that's really what it's about. So, everyone listening, I hope you've really enjoyed this conversation. I've definitely enjoyed it. It's been really nice to, finally be able to really connect one-on-one and dive into your story and learn more about all of the work that you're doing. And in the last few minutes here, I always like to open up the platform. Any websites and other things, anything that you want to promote, or any last notes or comments that you want to share, I hand over the podcast to you to close us out.
Okay. Well, thank you so much for the invitation, Jason. It's been amazing to sit here and talk with you for this time. People can find me at holisticcaring.com, 2 C's in the middle, Holistic Caring. It's the totality of health and bringing things together, mind, body, spirit medicine, integrative medicine, and cannabinoids. So Holistic Caring is where you can find me. Elisabeth with an S. I'm Swedish. So Elisabeth with an S at holisticcaring.com is my email. If you'd like to reach me, just send me a quick note and we'll engage. And God bless you and the work you're doing. And thank you again so much for the invitation.
Thanks so much. And everyone that's been listening, if you want to learn more about Curious About Cannabis, check us out at cacpodcast.com, or find us on Facebook, Instagram, Twitter, YouTube, or LinkedIn. And with that, everyone, stay curious and take it easy and have a great rest of your day. Bye-bye.
If you want to learn more about cannabis, check out the Curious About Cannabis book on Amazon.com and other major online book retailers.